In general, lymphoma is a very sensitive tumor to treat. So we're talking about the MRD. For a lot of solid tumors, it's very hard to get them into a complete remission. There's still tumor left, so it's very hard to use the word MRD when you can still use the tumor. So we feel very lucky we're treating lymphoma because lymphoma is naturally sensitive to interrogation, and we're very lucky to be in this field. And we're lucky that we're dealing MRDs because we're able to cause complete remission in many lymphomas, either T or B cell lymphoma. But let me give you an example for large cell lymphoma, how MRD could help us. So far, large cell lymphoma could be cured 60% of the time with a frontline therapy called R-CHOP therapy. 40% relapse, and once they relapse, is no longer curable. So the mortality is 40%. But how do we know who are the 40%? Who are the 60%? So after you finish the frontline therapy, you use the MRD. Those people who has MRD positivity very likely belong to the 40%. So the frontline therapy is not enough. You have to add some other therapies to make the MRD go away so that this 40% get reduced to 20%, 10%, eventually to none. So we can use our MRD to cure large cell lymphoma. Likewise, we can use the MRD in every scenario in other lymphomas. Peripheral T-cell lymphoma is a frustrating disease to treat because even after transplant, it's not curable, it comes back. So after transplant, if we still decay the MRD, we have to guide the maintenance therapy to cure the MRD so that to prolong the duration of remission, prolong the survival. Very useful. For indolent lymphomas, it's less useful because the indolent lymphomas, even the tumors there, we don't have to treat for most of the time, so watch and wait. For the high-risk follicular lymphoma, we wanted to use good therapies to cause a complete remission. Then the MRD become very handy after that. MIP and FLIPI are used at the diagnosis. If the patient keeps relapsing, such as follicular lymphoma, the MIP is no longer that useful. But the MRD become very important. The MRD is not only measurement the amount of the tumor left, but also tell us which clones are positive. So the MRD in follicular lymphoma, although it can measure the amount, but the most important part, please remember the spin to the sequencing, the cloning. So once we know which clone is active, we know which pathway is overactivated, we can kill that clone with that pathway inhibitor or the combination of pathways inhibitors. So those MRD in this therapy, in the field of lymphoma, is not only to measure the residual disease, the relapse of the disease, but also tell us what the disease is sensitive or refractory to. So please remember, MRD have another spin, another quality to cause cure in this aspect.